To Limpopo now, where the province hopes to give over 38,000 school staff their COVID-19 jabs by the end of today. Yesterday, Basic Education Minister Angie Motshekga launched the provincial vaccination program for the education sector. More than 580,000 education staff are expected to be vaccinated by the 8th of July. eNCA's Lindokuhle Xulu has more details for us. He joins us from Polokwane. Lindo, we spoke earlier, and I think a lot of what's been happening, especially with teachers' unions also saying they need to speak to the education department as well. There's concern over hesitancy. What have you seen in Limpopo?
Well, Maseko, I can tell you that hesitancy, we haven't seen it, because yesterday when they were launching this particular rollout of educators, I can tell you that there were queues of many educators raising up their hands and saying that they are going to get vaccinated. And in fact, I tell you that Minister Angie Motshekga yesterday is the one who said that she's thankful that she's seeing the numbers come in. But we want to just speak to the MEC of Health here in the province of Limpopo, just to get a sense and make sense of those numbers that you are talking about when you speak about hesitancy versus those that are coming to get vaccinated. MEC, thank you so much for joining us. Just give us a sense of the turnout. There are people who are concerned about the hesitancy, but is the turnout spelling out that people are hesitant of coming to vaccinate the educators?
Morning to all your viewers. What we can indicate as a province, judging from yesterday, we cannot make a conclusion that there has been hesitancy, because if you remember, by closure of business, I had anticipated that we might have vaccinated around 14,000. But by closure of business, we had already vaccinated more than 16,240 just in one day. Today, of course, in the morning, there are areas in the province where there has been, in the morning, started slow. It's a Saturday today. We expected it. Some of educators start by attending funerals and other commitments. It's their month, and one of them was saying, I need to start at the bank in town first so that we arrive. But right now, we have now started to see numbers in facilities like Petersburg Hospital, where I'm going there now. It's overflowing. If you go to Limpopo Hospital, somewhere in Lindokuhle, it's overflowing. So what we're going to do, we'll be moving vaccines from a certain areas to another. Because in terms of the teachers, because they are residing in certain areas, most of the teachers stays in town and working in the villages and in townships. So they use the Saturday as an opportunity to be vaccinated where it's closer to their home, not necessarily closer to their school. We might have, together with basic education, register them to be vaccinated closer to their school, but they would opt to be vaccinated closer to their home. So those are the issues, logistics, that we are currently trying to resolve. But one thing that we can reassure you is that by closure of business today, there won't be any dosage that is left, unless we're saying there are teachers, all teachers have been vaccinated. It means if a dosage is left, it means the 38,000 that we were given, there were more than those teachers whom we needed to vaccinate. Because remember, there are many teachers who were telling me that they've already received the Pfizer vaccine because they are above 60. So because of that, you might find that the numbers that we are given might be more than what we currently have in the system, because the system was not able to differentiate to say this one is above 60, he doesn't need to get Johnson & Johnson, he has already got the Pfizer. But in terms of our logistics, we are here, we are ready, we'll be here the whole day to make sure that all systems go. Because why we are doing this as health, we want to see ourselves really getting herd immunity, and we are looking at sectors that are vulnerable, looking at the third wave itself. As a province, we've seen many of our schools were having a lot of cluster outbreaks within the schools. The second area where we've seen a lot of cluster outbreaks, it's within the mines. You know, Limpopo on its own, Waterberg district, it's currently leading in terms of numbers, because the mines, we have every day, Lepalale mine today, I was told they've got another cluster outbreak. So the next area we might find ourselves having to go to those areas and vaccinate them. So if we vaccinate with speed, we can be able to assist and make sure that we reach in herd immunity more quicker than it's anticipated.
Just as the last one from me, MEC, because you've covered comprehensively some of the questions that I had. The Minister of Education yesterday commending the province for being one, in fact, the leading province in terms of vaccinations, that a rollout of 60 plus. And the question then becomes, what really is the secret behind being the leading province and making sure that those vaccines get, especially to those rural areas?
As a province, from the beginning, we have always been saying, even when it comes to fighting the virus, we understand and appreciate the material conditions on the ground. We will never think we will compare ourselves with provinces that are in cities that are well-resourced. That is why when we were told that you must move to phase 2 vaccination, the first question that we asked ourselves was that, now if this phase it's dictating that every citizen must be registered on the EVDS before being vaccinated, how are we going to achieve this? Because the group that is up 60 and above, on their own, because of advanced age, firstly, they don't understand the internet connectivity and all those. Secondly, they don't even have those smart and Android phones. Thirdly, they stay in rural areas where we don't even have network connectivity. That's why we came up with strategies like getting our healthcare workers to go and register them, talking to them. That is why we understand that the group, Limpopo as a population, we have analyzed our people, that they've got so much confidence in their traditional leadership, they've got confidence in their faith-based organization, they've got confidence in their traditional healers than they do even with their medical doctors. So that is why we work in collaboration with all the community leadership, and that collective effort, it's not something that you can put it on the Department of Health. You must just say the people of Limpopo on their own, they've been able, being led by the Department of Health and the provincial government, to achieve what they've been achieving. And the other thing that we are doing here is that not only do we go and register them, we even go and take the vaccine to them. What was delaying us was the sustainability and the stability in terms of vaccine supply. Now that we have been reassured that come July, we are going to see the vaccine supply rolling out, becoming more sustainable, you will see us starting to move to those villages on our own, where we are going to be vaccinating, because currently even the above 90, the above 100, we are vaccinating them in the comfort of their home. So that is what is making rural provinces to perform better, because they understand their situation.
Let me see, you've eaten my time, but give us a sense. Are you going to finish with the 38,000+ vaccines? Are you confident that the numbers will be coming and that you will be completing this process?
I've already indicated that if the dosages are not finished, it's either we don't have educators out there who require the vaccine. But if there is an educator who needs the vaccine, all dosages will be finished. We are working with education to try to check where are the educators. If they are all vaccinated, then we are happy. We'll take the dosage and vaccinate another sector.
All right. Thank you so much, MEC of Health, Ramathuba, the Dr. Ramathuba, just giving us a sense of how it's been going. Day one, we understand that over 16,000 was done, but at this stage, they are saying that more vaccines are still available, and teachers who are willing to take the vaccine must come forward into the respective vaccination sites, which are 37 in the province, as we understand.